Aloha everyone, my name is Kelly and I'm the Infection Control Program Manager for Maui Health System. Patient Safety Awareness Week is an annual event intended to engage and encourage staff members to provide safe patient care. Hi everyone, good morning. We are here kicking off Patient Safety Week. The purpose of this week is for everyone in-house to share their personal patient safety commitment and what they do on an everyday basis to make sure that we deliver safe patient care. Today we're doing post-its on our non-social media wall. We are also making sure that everybody knows our national patient safety goals. So come on down and I hope you guys have a great week.
For our patients, what we really want to do is give them privacy at all times. We're in the operating room and especially they're afraid, they're scared, they're cold, but we want to keep all the blankets on them and give them as much privacy as possible to let them know how much we care about them.
I support patient safety by washing my hands.
One of the things that I do to keep our patients and staff safe is daily rounding.
We have bedside glucometers, iStats, HMS Plus instruments in the OR that are used for testing at the bedside of our patients, and my job is to make sure that they are A-OK when we need them.
That is such an important big topic, Kelly. Thank you for asking us that question. I am all on board for this. One of the things that I do is I do many of the surveys. I come to your floor and I'll visit and we'll just do little checks to see how things are lining up.
Well, in the OR, we are big proponents of checklists.
I encourage medical interpreting for the language English proficiency patient.
Everything I do is to promote patient safety.
I promote patient safety by locking the wheelchair before a patient gets out.
Hi, my name is Lily from Holly East. Check patient ID.
Wash hand and ID check.
Yay!
Check their identity, not by telling them their name or reading their name, but by asking their name.
I promote patient safety by educating other staff about pancreatitis regarding their signs and symptoms.
I make sure that we're gonna tell the nurse any changes in the rhythm.
I have to make sure that patients' diabetes medications are ready and there is an outpatient diabetes educator follow-up as necessary.
We provide patient safety care by providing our equipment safe too by adjusting it according to the patient's height and by providing our gait belt.
Myself and all our volunteers practice patient safety every day. We make sure our hands are washed before we go into a room and after we leave a room. If we're going around bringing sweets, we make sure that patients can have the sweets.
The only way to be safe is to be maka'ala to your surroundings and the people that are around in our community here in the hospital.
We promote patient safety by coming to bed briefing daily.
So every time a baby is born, we always put the bands on baby and on mom. So every time that the baby is taken out of the room and comes back to mom, we always read the numbers.
I work at Kula Hospital, the emergency room. And one of the ways that we provide safe care is we see what kind of allergies they have, protecting our staff and the doctors and ourselves with protective devices such as face masks, gowns.
I listen to what patients need and I pay attention to them and I do my best to kind of be responsive to what they need.
I like working with these patients to help keep them safe just by keeping them busy. So stimulation and socialization, trying to do that at least once a day in a group setting or individually.
I work at Kula ER and we have patient safety by putting the rails on the bed up. Looking at their ID band.
Well, we work hard to make sure our equipment is running, that we maintain food temperatures, food safety and sanitation regulations, making sure our food expiration dates are good, and making sure our hot food's hot, cold food's cold, and that our sanitizer chemicals are all in the proper concentrations.
To ensure patient safety, we always check 2 patient identifiers before passing medications.
My pledge for patient safety at our hospital is to continue to do rounding with my nurse managers and improve the depth of rounding that we do.
We want to make sure that the room is clean and organized.
I pledge to keep my patients safe by rounding on them every day.
We
We promote patient safety by attending safety briefing daily.
Aloha, my name is Raisha Mamala and I'm with the Communications and Marketing Department at Maui Memorial Medical Center. On behalf of Maui Health Systems, we would like to thank each and every one of you for your endless efforts in making this week a great success. Mahalo.